Hello everyone, this is Dr. Jacobs. In this video, I'm gonna go over how to stop bursitis pain. But before we do that, we need to understand what is bursitis or bursa, the causes and the risk factors for bursitis. That will help you to relieve a lot of your symptoms and also prevent your having bursitis in the future. But before we start, we need to understand what is a bursa. Bursa is a small fluid sac that located in the joint throughout your body, everywhere. You have it everywhere in your hip, your knee, your ankle, your foot. So actually the function of the bursa is to protect your muscle and tendon from rubbing over the bone. So I'm gonna give you a demonstration here. So let's say this is your muscle. It should be contract and relaxed like this. So the bursa is a small sac that actually located between your muscle and your joint, which is a bone. So I will say this is the white rubber, that's your bursa, and the bone is here. So when your muscle contract and relax, it should be stretched, and that rubber in here should be protecting your contracted muscle from actually rubbing over the bone. So it's a protective mechanism. So that's basically the bursa function, the main function for the bursa. You can see it here in this image, the blue tissue here, that's the bursa, that's protect from rubbing the tendon and the muscle over the bone. And here in the elbow, that's on the right side, you can see the bursitis. That's an inflammation of the bursa in the elbow area. So the main function, it's a cushioning. Another good image for the knee. It's very common to have like bursitis in the knee, hip, or ankle or shoulder. And when you start to have inflammation, that bursa start to swell up, as you see it in the image here on the left. So what are the causes and risk factors? One of the main things that actually consider a risk factor and causes for bursitis is repetitive motion. That like throwing, like for basketball players, if they do like repetitive motion without proper warm up and overtrain, they might inflame their bursa from overuse. It also could happen from excessive kneeling, and that's usually as a risk factor for several positions, like carpenters or someone lying on the floor doing some like plumbing or gardening or painting or playing an instrument for a very long time. It's overtraining without taking enough break, and they might have bad mechanics. So it's kind of like constant rubbing on the bursa tissue that will make it swells up. So one of the other risk factors are systematic diseases, right, like rheumatoid arthritis, gout, and diabetic. So one of the most important question is how to treat the bursa inflammation or bursitis. Before we answer this question, we really need to understand how our body heals. When we do understand that, the normal healing cycle, we will have a better understanding how to get to the root cause of the problem and knowing which stage of the healing that's actually need intervention. So this is a normal healing cycle. I'm gonna use external paper cut for visualization, but the same process happen internally in your bursa area or any tissue in the body. Your body has to go through those three stages in order to heal. It doesn't matter what kind of injury and where is the injury. It's just one process to reach the healing. So with the external paper cut, the first stage is inflammation. As you see here in this image, the swelling, redness, the blood starts to rush to that area, and you start to experience pain. The second stage of healing is a proliferation stage, and you see it in the second image in the middle, that the body starts to build the scar tissue. So during the proliferation stage, there is a cascade of events fibrosis, which is a scar tissue, fascia restrictions, muscle spasm, trigger points. In perfect scenario, your body should actually get rid of all of these issues in the proliferation stage and clear up, and that's ending up the healing cycle, and it's called the maturation stage. If you still have issue, you're probably stuck either in the proliferation stage or you're actually going back and forth between inflammation and proliferation. I'm going to give you a good example. For scar tissue, what could be an issue? And I have a very detailed video about scar tissue, fibrosis, fascia restrictions, and muscle spasm with the anatomy and the physiology and how to address that. I will leave the link on the bottom of this video. So why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, should stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it does not stretch much. And that's because restriction in range of motion. And actually, if that scar tissue on the fascia area and you keep trying to do the movement, you're going to inflame the bursa and causing bursitis. So in reality, in real life, that it's never bursitis only. So in reality, most of the patient, they actually either stuck in inflammation and proliferation, the body going back and forth, or purely stuck in the proliferation stage, which is excessive scar tissue, excessive fascia restriction that compress on the tissue. So our goal is to know where you stuck in inflammation and proliferation stage, or you actually stuck just in proliferation only. So these are some of the treatment that currently used for bursitis, and I have videos on a lot of these, why these not effective. I just gonna go over this quickly so you don't have to waste your time using some of these modalities. Heat and ice. So when you look back to the healing cycle, based on the study, is actually ice temporary decrease pain for just half an hour to an hour. So it's not really a long term, it's not really addressing any of the root cause of the problem. Stem is the same thing, temporary pain relief, does not really do much to the inflammation and proliferation. Foam roller, think about this way. Foam roller actually it's going to be superficial rubbing. If you have inflammation, you're going to rub more, you're going to inflame it more. So that could actually aggravate the symptoms. And based on a study, there is no long-term effect of the foam roller on improving function or pain. Massage is the same thing. You will not be able mechanically to really release deep scar tissue or deep fascia restriction with the massage. Actually, if you massage it, the inflamed area, there is very high chance you're gonna inflame it actually more. You don't want to rub over open wound. It's gonna get worse. Stretching. So think about this way, you actually have bursitis because overtraining or leaning on that joint or overactivity, which means that if you're gonna continue stretch over that area and doing the same exact motion, you're actually gonna make it worse. And based on the studies, stretching is temporary. There's other alternative to stretches that more effective without causing the harm of stretching. And I have a video why you should not stretch, period, for any musculoskeletal injury. I personally do not give stretches to my patient. You're gonna slow down the healing. It's gonna interfere with the healing. So there's a lot of other alternative than stretching. And there's a video about why you should not stretch ever in my YouTube channel. So strength exercises, we have to do that, but we need to know when to do it in relation to the healing cycle, because if it's inflamed, you're gonna make it inflamed more. We need to be aware of the healing cycle and introduce function training and exercises on the right time so it does not cause inflammation. So I'm gonna go over the main two stages here that could cause issues with the bursitis, or does not matter what kind of musculoskeletal injury, because it's never bursitis only. You're going to have a scar tissue with it. You're going to have fascial restriction. You're going to have muscle spasm and trigger points. And it's never bursitis by itself. When you palpate and you start to feel nod, there's a high chance of scar tissue. So when we address the problem, we have to address the healing cycle. So for inflammation stage, what the best way to do? Well, first of all, you need to stop whatever you're doing that caused the bursitis pain. So if you are a basketball player, you need to stop the motion that actually causes it more inflamed. If you are in acute stage that's not too severe, just rest a few days, 3 to 5 days, that should be enough for your body to recover. Or if you are like doing like a carpenter or someone kneeling on their knees and they have bursitis in the knee, try to avoid that kneeling or get a knee pad. So we try to avoid whatever causes more inflammation. For moderate to severe inflammation, and what I usually do is I use a Magna Heel, like you see it here in the image, with the 3 belts that you can wear it anywhere. That's the range of the Magna Heel 2 is about 3-inch magnetic force, so that can be used to decrease inflammation. And I have a video on the Magna Heel. I have a video on the anti-inflammatory diet. This is second. I usually, my recommendation, the rest and the Magna Heel first, and then anti-inflammatory diet, just to make sure your body is healing fast. Here's another thing that's a lot of healthcare provider overlook is if you have vitamins or mineral deficiency or hormonal imbalance, your body never gonna move smoothly from inflammation to proliferation to maturation. So if you have magnesium deficiency, zinc deficiency, D deficiency, B deficiency, none of these actually gonna replace those deficiency, even the anti-inflammatory diet. Because if you have deficiency, you need more than what you eat on a daily basis to replenish that deficiency. And for those people who has chronic bursitis or inflammation, I recommend check out Ask ASTR. It's askastr.com. It's a free online medical evaluation that will help you, guide you through the process of possibility of any deficiency you might have that interfere with your healing. So take advantage of it. It's a free. Just go to askastr.com and just take 5 minutes to really figure out what could be possibly deficiency that could slow down your healing. So that is the inflammation stage. Now, moving to the proliferation stage, there's several things we have to address it simultaneously, so the body will move smoothly to the maturation stage. So the first thing we need to work on is the scar tissue. I have several tools to work on the scar tissue, and there is a special protocol. We don't do the inflamed area with the tools because you're going to inflame it more. So what I personally do with my patient, and I give them in a home treatment program, is to actually work on the whole muscle. So if it's actually the knee, a lot of the knee muscles attached, especially the quad, is attached in the patella tendon here and going all the way to the front of the hip. So you want to release the whole muscle, and you will probably feel when you palpate a lot of scar tissue, fascial restriction in that muscle. And when that muscle, like for example in here, let's go back to this, here. When your muscle has any scar tissue or any fascial restrictions in any location of it, either here, here, or in the middle, you have to release it because it's gonna stress the end part of the muscle, the muscle and the tendon that attach to the bone, and rubbing more on the area that has the bursa and will inflame the bursa. So you have to release the entire muscle, and that's what we do. And I have several tools to break the scar tissue. For example, the A3, I use this to release the entire muscle to work on breaking down the superficial scar tissue. And I use also the A5 tool. This can go very deep to really break any scar tissue, deep scar tissue, release trigger points, and actually release fascia restrictions. So there's several tools because there's several layers and in the body that one side does not fit all, does not get there to cause mechanical force to really do the release. So briefly, if you need to really learn more about the scar tissue, I have detailed video about scar tissue with the science and the studies that support the treatment for scar tissue release. So the second system that we need to work on is the fascia system, fascia release. This is one of the things that really overlooked by healthcare providers and patients because there's not a lot of effective treatment out there to release it. And that's why I developed several tools to work on that specifically. And I'm just going to give you a quick overview about the fascia system just to get understanding how complex that system, and that's why one size does not fit all, because there's a lot of claim you do myofascial release with the hand or foam roller. It's impossible to do that with the foam roller and with the hand because mechanically you cannot go deep enough. So those claim is actually looking at the anatomy, it's actually discredited just by understanding the anatomy. But when you look at the studies, and I have a video on that, the studies that done on foam roller, myofascial release is not providing a long-term result. So the fascia layers, we have two categories of the fascia: superficial layer and deep layer. Superficial layer, each layer is actually consistent of two to three sub-layers on the top of each other. The fascia is very thin layer that's wrapping the entire body. That's a superficial fascia. It's the white web look like tissue that when you open the body or you remember in the anatomy class. So the deep layer divided to four subcategories, and each one has like 2 to 3 sub layers. The apparatic fascia, this is a layer of fascia that's wrapping a group of muscles. The epimysium, that's wrapping each individual muscle, has a wrap of fascia. Premiysium, that's a wrap of fascia that's wrapping bundle of muscle fibers. The endomysium is the fascia layer that's wrapping each individual fiber. Why I'm presenting this? Because I want you to understand how complex the system. That's why you need to have several tools to really get to each layer. Otherwise, with the healthcare provider using the knuckle or elbow, it's impossible mechanically to go that deep or distinguish between those layers. And for who using foam roller, you're wasting your time because you're only working on the superficial layer. But the reality is, if you don't grip on the fascial layer like with the ASTR tools to hold the layers, you will not be able to release it by just rubbing over it. Mechanically, is impossible to cause physiological change to the fascial layer. So this is a very good image, and it shows you here, you see here the epimysium. This is a layer that's wrapping the muscle, the entire muscle, the white part here. You have the premiysium that wrapping a group of bundle of muscles, and endomysium that wrapping each individual fiber. And someone will say, like, how it feel when they have fascial restrictions? It's gonna feel you wearing t-shirt 2 to 3 size too small, or you feel like something kind of squeezing on your tissue like that. It could be internally or in individual fibers or the whole muscle group. So that's how it feels. And when you palpate, you will feel like a rope or band that is really very tight internally. That's usually the fascial layer is very tight. And why that could be significant? Because when this tight, it compresses on nerve artery and it causes inflammation because it suffocates the tissue underneath it. And when that happens, think about if you are wearing a t-shirt 2 to 3 sizes too small, you will never be able to move freely because the t-shirt will limit your range of motion, and that's what fascia does. And I have really in-depth detail about the fascia in another video. If you're interested, just to check the link below. So what we do for the fascia, we have to work on each layer, and I go that in detail in the patient and provider programs, how to work on each layer with which tools. So what I use a one to work on the superficial and the first deep layer of the fascia, just gripping on the fascia layer and releasing it. So, and I also use the A5 to really work on each of those individual layer, and there's a sequence and there's a way to do it, and this can go very deep in the body to get to those layers when it's used correctly. So, how we treat bursitis, as I mentioned to you, it's never bursitis by itself. There's other issue. It's very common to have bursitis and tendonitis at the same time. I will have a video about tendonitis too. But rule of thumb, you need to understand how the body works and really work with the normal healing cycle, and that's how you're going to get to the root cause of the problem. And instead of doing stuff for the symptoms only and like by narrow-minding, thinking it's only bursitis, but it's never like that because your muscle going to be tight from the fascia restriction and from the scar tissue. So to summarize what you should do at home, first thing, you have to stop the repetitive motion that actually cause the bursitis. Whatever you've been doing that causes inflammation, you have to stop that. Even if you do treatment, if you continue doing those motions without proper warm-up or having enough break in between activities, you're really gonna make it worse. Second thing, what you can do at home, if you have to kneel and continue working as a plumber or carpenter or doing stuff on the floor, you have to get knee pad or elbow pad, wherever you kneel on like joint, you have to have a protective pad. So you decrease your risk of having this issue in the future, and also decrease the pressure on that fascia area that get inflamed. So if you are in chronic inflammation or chronic bursitis, you need to start to working on intervention, which including the MagnaHeal. In the patient program, I include the anti-inflammatory diet. And if you have really severe chronic inflammation, I recommend ask ASTR to see if you have any deficiency, because if you have deficiency like zinc, magnesium, C, B, D, your body is not going to move properly from inflammation to proliferation to maturation. Lastly, for a proliferation stage, you want to work simultaneously on the scar tissue, fascia restriction, and trigger point. As you see in this stage, there's not much else in here that need to be worked on, but you have to work on all of these simultaneously to get to the maturation stage. So, so that summarizes how to address the root cause of bursitis or stop it at home. I will see you soon in the next video. If you have any question, just leave a comment on the bottom, and I will try to answer it in the future videos. See you soon.